The UCI-Fred Hutch Cancer Centre launched by Uganda's president consists of an outpatient clinic, chemotherapy infusion rooms, research laboratories, molecular diagnostic labs, a specimen repository, a training centre, a library and a data centre.
Improving on technology in cancer care, because we are partnering with Americans to bring what has been taking Ugandans to America or China or India, and this is it. So this institution is similar to that one in Seattle.
The American people, through the U.S. Agency for International Development's Office of American Schools and Hospitals, provided $1.4 million to help build and equip the state-of-the-art facility.
Dr. Corey Casper, the head of Global Oncology at the Fred Hutchinson Cancer Research Centre in Seattle, Washington, says Fred Hutch has helped Uganda over the past decade when it partnered with the Uganda Cancer Institute. To him and the team, this is an enormous opportunity that will make a huge difference.
Many firsts for cancer were developed here on this campus. The first place anywhere in the world chemotherapy was given in combination to treat cancer was here. The first virus which was found to cause cancer was found here. But it's time now to take this to the next step because so many Ugandans are suffering right now from cancer. More people are dying of cancer than of HIV, tuberculosis, and malaria combined.
That we would not just tackle Kaposi sarcoma and Burkitt's lymphoma, our initial and frankly first singular focus, but we would start a training program and build a team of people that will tackle the types of cancers that are most common and difficult in Uganda.
Ugandans are mainly burdened by 3 cancers: cervical, prostate and breast. Most of the cancers affecting Ugandans are, however, preventable, a fact President Museveni picked on.
So if we take all the preventive measures, then we can reduce the disease burden.
The president wants more cancer screening and testing centers spread all over the country.
If it's not technically impossible, I think the sub-county may be the nearest.
The UCI-Fred Hutch Cancer Centre is expected to be treating about 20,000 people annually. But most importantly, more health workers are going to be trained. And there's going to be a lot of research undertaken at this facility.
Many people think research is a luxury you can't afford to do when there are so many patients. But we don't really know right now the best way to treat cancer in Uganda. So together, we will look for new ways to prevent and treat cancer.
This is one solution to taming cancer. The second is capacity. The country doesn't have enough people to deal with the burden.
Not enough doctors, not enough nurses, not enough pharmacists, not enough researchers or scholars.
The Fred Hutch team have trained 12 oncologists in the past decade. The country now has 20 with expectations of getting more. For Dr. Joyce Kambugu, the only pediatric oncologist in the country, the tide has indeed begun to change against the disease that records about 4,000 new cases every year at the Cancer Institute.
So if I came here next week, I would find you working.
Yes, Florence Nalimba, NTV.